So I'm going to do some questions with you. My name is Sherry. We're going to go over your complete health history,
Okay.
some cultural questions, some personal questions, just health history in general. And is it okay if we record this? Are you okay with that?
Yes.
Okay. All right. So can you start by just letting me know your first name?
Cynthia.
Okay. And what town do you reside in?
Monroe, New Jersey.
Okay.
I had to think for a second. I almost said Edison.
Okay. And your date of birth?
7/22/57.
Okay. And your age?
How old am I? 68. Am I 68? I don't know. How old
Sometimes
am I?
you lose track,
I
right?
do lose track.
Okay, and sex is female. Marital status?
See how old I am. Marital status is divorced.
Okay. And your health insurance, primary health insurance?
Aetna.
Okay, do you have any supplemental?
Medicare.
Okay.
Yes.
Do you have an advance directive?
What is that?
So that's like for healthcare decisions, like if you ended up in the hospital. Okay.
I should, but I don't. I am 68.
It's something that at your
67
next
years old.
physical you can discuss with your primary care physician.
Okay.
Okay.
Did you put 67 for my age?
I put 68.
Okay. Well, I'll be 68 in
Okay.
July, so.
I think my own mother doesn't know how old she is either.
Yeah.
Okay, so how would you describe your current health status? Healthy?
I would describe my current health status as moderate.
Okay.
I would say moderate
All right.
because I do have health issues. So
Okay, and we're
guess
going to
that's
get into
moderate.
that. And then who is your primary care physician?
Paringa, SI. What is it? SIGHC.
Okay. And when was your last physical?
My last physical was October 2024.
Okay. And then I'm just going to go through a list of exams, and you can just let me know if you had that done and if you know the results of them. Did they do an EKG at that time?
Yes.
And it was normal?
Yes.
Okay. And chest x-ray?
No.
Okay. Any dental work in the last year?
Yes.
Okay. Any issues, cavities, fillings, anything needed to be done?
I got a new bridge
Okay.
replaced.
Eye exam in the last year?
Yes.
Any issues with the eye exam?
My exams are follow-ups from my what is not glaucoma? Geez, I can't think. Cataract surgery. Thank you.
Any need for ear exams, like hearing tests or anything at the exams?
No.
Okay. Any rectal or colonoscopy exams in the last year?
Not in the last year.
Okay.
I'm not due for colonoscopy for another few years.
Okay. What about a mammogram?
Just had one a couple months ago.
And it was normal?
Yes.
Okay. Pap smear, do they do those on you at this point? I know sometimes
they don't do them anymore because I have a hysterectomy.
Oh, okay.
Yeah.
And then blood work. Did you have blood work done at your physical?
Yes.
And how was your blood work?
The A1C is a little high.
Okay.
I think everything else was okay.
Okay.
Yeah. They just are watching the A1C.
Okay. Any need for HIV testing?
No.
Okay. Current medications?
Oh, geez. I got a list. I carry my list around in my purse. I have to grab it though.
We could circle back. What about over-the-counter medications? Do you take any supplements, vitamins?
Yes. I take B12.
Okay.
I take turmeric, cumin turmeric supplement. I take 81 milligrams baby aspirin, and I take a multivitamin.
Okay.
Okay, I think I can think of my meds. I know I take lisinopril. Let me see. I don't know how
And that's for your blood pressure?
Yeah.
Using that daily.
And daily. Metformin for type 2 diabetes.
Do you know how long about you've been on the blood pressure medication? Has it been more than 5 years?
Oh, yeah.
Okay.
For a long time.
Okay.
Years.
And would you say it's effective? It's controlling your blood pressure?
I do go to a cardiologist once a year, Dr. Pasolaris, and they do a stress test every year just to stay on top of it, right? What is it? Aceta? Oh, what is it?
And then back to the
Metoprolol.
Okay, and back to the metformin. That's for the A1C.
Yes, the metformin is for the A1C.
And that's also daily.
Yes.
Okay, and greater than 5 years? Would you say you've been on that?
No.
No.
Only like a year.
Okay.
I just literally had to start taking it.
Okay. And would you say that's effective? Has it lowered your A1C since you've started it, or you haven't had that follow-up blood work yet?
My last blood work was the follow-up blood work, and it did bring it down a smidge, but still not enough that, Dr. Singh said she wants me to continue it.
Okay.
She did want me to take it twice a day, but it makes me sick, so I can only take it once a day.
Okay. And then the metoprolol, that's for your blood pressure?
Yeah, blood pressure. I said lisinopril.
You said lisinopril.
Simvastatin for cholesterol. And there's one more.
The metoprolol, how long have you been on that?
Forever.
Okay. And is it effective?
Yeah. Okay. Yeah. All the heart stuff and cholesterol stuff that I take really keeps it.
Okay, good. We could always circle back. There's 4 you said, and I think you said you had
I think
one
it's
more.
one more.
Okay.
After.
So for medical history, so you said you had the A1C, so type 2 diabetes.
Type 2.
You have hypertension and high cholesterol, correct?
Yeah.
Any other medical issues?
Well, they say I'm overweight.
Okay.
Obese.
Okay.
Is the term. Right.
So we're on meds for the diabetes, meds for the hypertension, and the cholesterol. And we would say they're all at this moment controlled, yes?
Yes.
Okay. And the obesity, has the doctor done anything for that? Any medication, any treatment?
No, just recommendations. Okay. And I'm considering, but I haven't decided.
Okay.
Because I have concerns about going on Ozempic and all that stuff, because if you have to do it forever for the rest of your life, I don't want that kind of stuff. Maybe think about something that can help, that when you get to a certain point, you can phase off of it.
Okay. That's something you can talk to her about.
Yeah.
Any surgeries?
Lots.
What were the maybe most recent in the last 5 years? You mentioned a hysterectomy.
Oh, yeah.
How long ago was that?
Oh, that was, I'm going to say, how old is Travis? Like, at least 35 years.
Okay.
Long time. C-section.
Okay.
Foot surgery.
Do you know about when you had the foot surgery?
Travis was 3 years old.
Okay.
So a long time. I cut my hand when I was like 22, 23.
Okay.
So that was a surgical repair.
Okay.
And the cataract.
Okay.
That's it, I think.
All right. And the cataract was how long ago?
A year.
Okay. And as far as outcomes for these, all good, no issues after these surgeries?
No.
Okay. Mental health history? Any mental health history? Sorry.
For myself or?
Yeah, for yourself.
Oh.
I think eventually it goes into family.
Yeah. Okay.
Accidents, injuries, like
oh, my knee surgery. I forgot my knee. My torn meniscus. The robotic person.
Any accidents like can't even think of an example. Car accident that led to an injury, or
No.
Okay.
Nothing like that.
All right. Do you know if you have any allergies to medication?
No.
Food?
No.
And what about environmental? Any
Environmental, definitely. I have seasonal allergies.
And what kind of symptoms do you get?
Like sneezing, runny nose, eyes, all of those things that, you know, if it flares up, you know.
Do you take
But I can
anything
take
for it?
I can take the over the counter stuff that
Okay.
is like helps anything I see in the regular.
Perfect. Do you know your blood type and the RH factor, like whether you're A positive, O negative? That's okay. Go ahead.
Can I get it?
Yeah, go ahead.
I think I'm O positive. I'm pretty sure. I do.
I didn't realize I needed lists of things. I would have told you to have them handy.
Yeah,
Sorry about
yeah.
that.
That's okay. Let's get into the wallet. In case anything ever happens to me. Let's see what I got here. List of meds. Where's my... Let me just take my time. See, it's in here. Because I throw every card I get. That's the dentist. That's the storage bin. Oh, there I am.
Okay. O positive. Perfect. All right. So now we're going to go through each system of the body, it looks like. We're going to go through starting with eyes. So general condition of your eyes. You've mentioned you had the cataract surgery.
Yeah.
How is your vision now? Is your vision, do they tell you?
Oh,
like,
much better. Oh, so I am 20/25 in the right eye.
Okay.
And 20/23, I think, or 4 in the left eye.
Okay.
The left eye. And 20/25, they told me is really good. It's supposed to be better than 20/20.
Okay.
They say. Everybody think 20/20 is perfect vision, but
any recent changes since your last exam? Everything's been okay since last exam?
yeah, nothing.
You wear glasses, I see. So we have corrected vision. Any issues with your night vision?
Yes. I don't drive at night.
Okay. Any double vision?
No double vision, but I do have occasional floater.
Oh, that was the next question. And what about any like blind spots?
No, I don't think so.
Any infections in the eye that you know of?
No.
Surgery, you said you had the cataract. Any other surgery aside from cataract?
No.
Okay. Your ears, any issues with your ears,
No.
hearing? No lesions, nothing that you're aware of?
Not that I'm aware of.
No hearing aids, no surgeries.
No.
Okay. Nose and sinuses. So your sense of smell is okay.
Mm-hmm.
And what about pain, pressure, drainage, anything in excess?
No. Only time I have nose issues is when my allergies flare up.
Okay. And then so just as far as seasonal medication you said you use for that.
Mm-hmm.
Mouth and throat, sense of taste, teeth, any issues
No.
with that?
Everything seems to be okay.
Okay. Any caps, crowns, or dentures?
No dentures.
Okay.
I do have a bridge.
Okay.
No caps. But, you know, regular fillings and that kind of thing. Yeah.
Gums are okay?
Yep,
that
gums
you're
are
aware
good.
Of? Oral
Yeah.
hygiene is good. You see the dentist.
Yeah.
No issues with your tongue, swallowing.
No.
No throat infections or change in voice that you're aware of.
Nope.
Use of tobacco.
No.
Okay. And no surgeries in the oral area.
No.
Any respiratory symptoms? General breathing issues? Any shortness of breath?
No. No, not really.
Okay, lips and nail beds all look okay.
Yeah.
No issues there. No coughing.
No.
No problem at rest with breathing.
No.
What about activity?
Oh yeah, if I'm running around. I will get out of it. But that's
no devices used like I guess they're probably referring to like inhalers, nebulizers, nothing like that.
No
no recent upper respiratory infections. You said no tobacco use.
No.
And what about immunizations for pneumonia? Have you received those?
Okay. I've had my pneumonia. I think I completed the series.
Okay. And cardiac, general conditions. So you're on the medication, so high blood pressure. Any arrhythmias that you're aware of, like abnormal heart rhythms, no palpitations,
no
chest pains. We just said no breathing problems, and no shortness of breath, no fainting or anything like that.
No.
Okay. Dizziness.
No.
Okay, and color looks good. Not fatigued, overly fatigued, and never had any heart surgery.
No heart surgery.
Okay. Vascular system. So, do you ever notice like hands or feet are cold, or would you say vascular? You've never been told you have any issues?
No.
Okay. And blood pressure you said is controlled with your meds. No excess and bruising anywhere.
No.
No edema, varicose veins. No. Edema meaning like swelling anywhere that you've noticed?
No.
Sorry. Habit to use those words. So none of that. Any pain with exercise?
No pain. No.
Okay. And no change in temperature. You said like not too cold in the hands or fingers. Okay. All right. Abdomen. So your appetite. How would you say your appetite is overall? Good, bad?
Yeah, good.
Okay. They want, it looks like a 24-hour food recall. So, food intolerance. Is there anything you're intolerant to?
I'm noticing that I'm developing an intolerance to, what's that? Milk and...
Like dairy?
Dairy stuff,
okay.
Yeah.
No issues swallowing?
No.
Any recent weight changes?
No.
Okay. Bowel habits are normal?
Oh, yeah.
The frequency, consistency, no constipation.
Like clockwork every day.
All right, so no diarrhea, no need for laxatives, enemas, nausea, vomiting, and no abdominal surgeries.
No.
Okay. With going to the bathroom, peeing, no issues, no pain, no odors, no noticeable stream issues, color issues, no pain, no incontinence. Appliances, no bladder mesh, no history of kidney stones or bladder infections.
No.
Okay, and no surgeries.
No.
All right, on to your skeletal system. Muscles, size, shape, strength. Okay.
I guess
it's a tricky question because I'm supposed to be asking, not actually touching. So okay. Would you say you have good strength?
Yeah.
Okay.
Pretty
any
good.
Changes? Like, have you noticed any weakness on either side? Like weakness with one arm or leg or anything like that?
Not really.
Pain in any muscle areas?
I do have kind of stress points in my back and shoulders.
On the right side?
Yeah. Well, really mostly on the right side, but it's both sides.
Okay.
But I get a kind of a deep tissue massage once a month for that, and it helps a lot.
Perfect.
I think it might be too the way I sleep and the chair I sit in all day for work. Those kinds of things aren't helpful.
Perfect.
Posture wise.
Posture's the next one. Do you think you have good posture? Need some work?
Yeah, no, I don't think I have good posture. I could definitely. I just notice that I slump because I'm over a computer, that, and that does bother you. Yeah.
To the way you sit. Any bone issues, pain, fractures, deformities? No recent fractures, no deformities that you're aware of?
No.
Okay. And no issues walking, like as far as ambulating. I mean, whether pain or not, but you are able to walk.
Yeah.
For your joints, range of motion, you can move all of your joints, knees, elbows, shoulders. Pain. You said pain with the right shoulder. Any other joint pain that you might have?
Knees.
Is it both knees?
Yeah, both knees. And that's I'm told I had a bone density.
Okay.
And I have osteoarthritis.
Okay.
And I have it in my hands, knees, and feet, like those joints.
Okay. No stiffness or swelling.
No.
Either. Okay. And surgery was only the hand and the knee, correct? You had the meniscus, you said.
Yeah, I did have the left knee meniscus.
That was your left hand.
And left hand.
Okay. Neurological. So what are you, a righty or a lefty?
Left.
Lefty. Any sensitivity to touch or temperature?
No.
Any changes with like your daily living, like showering, bathing? No issues with any of that?
No.
Any headaches?
No.
No reason for fainting, visits to the doctor for fainting spells or seizures?
No.
Okay, not your gait either. You said that was good. You're not having any weakness, you said. And then there's no trembling, tremors, or tics that you've noticed neurologically? Okay. I'm getting tongue-tied. No paralysis or pain in anything?
No.
Okay, so we don't need to do that. And no dizziness, no mood changes, and no injuries to your brain? No brain injuries?
No.
Okay, down to your breasts. Would you say that there's any issues with the breasts? No issues there?
No.
Shape is normal. They're symmetrical. No nipple discharge, anything like that?
No.
Do you do a self breast exam or do you get it done? Okay.
I do that.
And then you also get the mammogram.
Yeah, I get the 3D mammogram because they told me my breasts are dense.
Okay.
So they always recommend that I heard they have a 4D now. So, but I get the 3D one so they can see it.
Do you have any history of breastfeeding?
No.
I guess no. And no other issues. You're not a male. All clients. So sexual orientation, straight?
Yep.
Okay. Are you comfortable talking about your sexual preference and activity?
Yeah.
Okay. Is there any sexual activity?
Nothing to talk about.
All right. So we don't need any of this.
No.
Did you ever have any issues with infertility?
No.
Okay. So any sexually transmitted diseases?
No.
Okay. You had a hysterectomy, you mentioned. So how long ago was that again?
It was at least 30 years ago.
Okay. So you're no longer getting your menstruation.
The reason I had that is because I had fibroid tumors, really bad, and I developed endometriosis.
Okay.
Very painful.
Okay.
So.
And no issues since the hysterectomy.
Right. I do still have one ovary.
Oh, okay. So you were still getting your period, or no? No.
Well, what it did was it bypassed
the menopause.
Yeah. I didn't go through the bad menopause because I had them. Yeah.
Okay. And then pregnancies. How many pregnancies did you have?
2.
2 and 2 living children.
Yeah.
Any missed abortions, miscarriages?
No.
Okay. Delivery was, you mentioned a C-section and a vaginal?
And vaginal,
okay. Any complications for mom or baby at that time?
Yes. I had toxemia with Kiana, and I don't know what they would describe it as, but the reason I had the C-section for Travis was an emergency because he had the umbilical cord.
Around
and he was like, the fetal monitor said he was losing oxygen.
Okay.
Yeah, so they had to just get him out.
And once he was out, everything was fine?
Yeah.
Okay. You're not male, so we can skip
Well, he had
that.
jaundice, but...
Okay, that counts.
Had to be under the light for a couple days.
All right, so mini mental. Okay, so I have a paper here, and it is a mental status exam. If I can find it, I printed it out. Oh, that's just a paper. Okay. So we'll do the mini mental exam, and then we'll go into spiritual. Obviously, anything that doesn't apply, you can say it doesn't apply, and then we will move on. So the mini mental state exam, we get scored. So I'm going to just ask you questions, and you just answer them to the best of your ability. Okay. All right. So what is the time? What's the time right now?
3:37.
Okay.
PM.
And the day?
The day is Saturday.
Okay. And the year?
2025.
All right. So you can get 5 points for that. What is the name of the Lord House? What is the name of this town that we're in right now?
Monroe, New Jersey.
Okay. You have to name 3 objects only once. Okay. Name 3 objects. So can you name
3 objects? Any objects?
I guess so.
Oh, water bottle.
Okay.
Plant.
Okay.
Fake plant. And table.
All right. Perfect. 3 points. So 3 points each. Repeat the objects so the patient can repeat them accurately. Oh, later. Okay. So we'll have you repeat those later. Okay. Attention and calculation. Can you subtract 7 from 100?
Oh, shoot. Off the top of my head. 92.
Okay.
I have to think.
It's okay. For each correction.
Math is not my strong
1
suit.
point for each correct subtraction. Okay, so 4. And then from that number, I'm going to have you subtract 7 4 more times.
Oh my God.
So you said 92,
Can I cheat?
but it's 90. It's actually 93. So
Oh,
from 93,
Okay.
we're going to go 7 again. You can use your fingers.
I'm going to have to use
It
my
doesn't say
hands
you
because I
can't,
can't think.
so that's
Okay.
fine.
92, 91, 90, 89, 88, 87, 86.
Okay. And then another 7 from 86.
85, 84, 83, 82, 81, 80, 79.
Okay.
Oh, God.
And then
One more time.
Yep, one more time.
78, 77, 76, 75, 74, 73, 72.
Okay. Oh, boy.
I had to get a rhythm. I had to,
I might need a mini mental exam.
wrap my mind around that one.
Good job. All right. So now I want you to repeat the 3 objects that we just talked about before you did the math.
Oh, the water bottle, the fake plant, and the table?
All right. Perfect. Excellent. And square each of the 2 name, pen, water. 2 simple objects. Pen, water. Oh, example. Okay, so 2 simple objects. 2 more simple objects that you can name.
Anything?
I guess, yeah.
Okay.
Like simple.
So my cell phone?
Like a pen, watch, like a
Yeah,
1-syllable word.
Oh, 1 syllable. Okay, watch,
Mm-hmm.
wallet.
All right, perfect. Score 1 point for an accurate repetition of the phrase. Ifs, ends, or buts. Can you repeat the 2 objects that you just named?
The watch and the wallet.
Okay. This is got me tongue-tied. All right. So you're going to write now on a blank piece of paper.
Okay.
I have one here.
Okay.
You're going to close your eyes.
Oh.
And on the blank piece of paper,
I have to write with my eyes closed.
Yes.
Do I hear that right? Okay.
I think so. Hold on. The patient's going to follow the written command. 1 point each. Ask the patient to write a sentence. Score 1 point if the sentence is sensible and contains a noun and a verb. So a sentence that contains a noun and a verb with your eyes closed.
With my eyes closed.
With your eyes closed.
Oh, jeez. Just one sentence?
Yeah, it says
Okay,
ask the patient to write a sentence. And you get 1 point. Oh, I guess the point doesn't matter to you, but it just has to make sense and have a noun and a verb. So like an example could be like the dog jumped over the hill or something
like that.
Yeah.
Yeah, that's what I was thinking about that. I was going to say I
Take
walked
your time.
to my car or something
There you
like
go.
that.
That could work.
But I got to do it with my eyes
You have
closed.
to do it with your eyes closed. Did pretty good. All right. You get 1 point for that. Oh, wait, hold on.
Oh, it's actually in a semi-straight line, too.
It is. And then you have to draw, is this also with your eyes closed? Okay, I think with your eyes closed. You have to draw a pair of intersecting pentagons with each side approximately 1 inch long.
Oh, Jesus.
Score 1 point if it is correctly copied.
Pentagon. Wait, let me identify a pentagon first.
Is that...
Octagon is the 8 sides.
You could look it up because
I
actually can't think of what a pentagon is either. So that way it gives you a better chance.
Check how many sides.
It doesn't say that you're not allowed to.
I want to make sure I know how many.
I feel like that might be 5
sides it is. 1, 2, 3, 4, 5. Yeah.
Okay. So it almost is like a house shape.
Yeah.
All right. So you're going to draw a pair, and they have to be side by side.
Mm-hmm.
And each of the sides need to be approximately 1 inch long. With your eyes closed, please.
Oh my God. Side by side?
Yeah. So a pair side by side.
Make sure I'm on the paper.
Yeah, you're on the paper.
Okay.
I didn't even see those back questions when I printed this.
Shoot. They're not going to connect.
I don't think they have to connect. Oh, wait, intersecting. So
intersecting. Intersecting got it.
Okay.
Intersecting, they have to cross each other, right?
Yes.
Oh, jeez.
That's okay.
Okay.
You've done pretty well so far.
Here we go. This is going to be a... All right.
All right.
Oh.
Pretty close. And it says at least one of them, draw a pair with each side approximately 1 inch long. So this one's approximately.
That one's this one's kind of.
Okay, so 1 point if correctly copied. So maybe you get a half a point since one isn't.
One is
and then
not.
It says maximum is 30, so I'll score these later and I can.
Okay.
But it looks like you at least got 5, 10, 15, 20, 25, 29. 30, 31, 32, 33, 34, 35, 36, 37, 38. Total
39
score
and a half.
30. So did I score something wrong? That says 5 points. That says 5 points. Up to a maximum of 3. 1 point for each. Oh, because I did these as 5. This is 1 point for each, up to 5 points.
Oh, okay.
I see. So this one didn't count. So you got 3 points there with the subtracting. That's my fault. I'm sorry about that. 5, 10, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 20, almost 25.
Okay.
I'd say that's pretty good.
Okay. If you say so.
I'll look up the scores later and see. I don't know
what it means.
Passing and failing is on that, so I will have to look into that. All right, so that one's done. This one is, I think, our next one after. All right, so we did that. Spiritual, when do we do the depression scale? Is that at the end, or am I supposed to do that now? Just bear with me a moment.
Mm-hmm.
Oh, I guess together, geriatric depression. Okay, so we can do this too. So this is a depression scale. Sometimes when you go to your primary care provider, they might give you a shorter version. There's now a 15 one. I think this is the older version with 30 questions.
Mm-hmm.
But it's more or less just a scale where you are on a depression scale. So I'll go through, and these look like they're yes or no questions.
Okay.
Are you basically satisfied with your life?
Yes.
Have you dropped many of your activities and interests?
Yeah.
Okay. Do you feel that your life is empty?
No.
Do you often get bored?
No.
Are you hopeful about the future?
Yeah.
Are you bothered by thoughts you get? Are you bothered by thoughts you can't get out of your head?
No.
Okay. Are you in good spirits most of the time?
Yeah.
Okay. Are you afraid that something bad is going to happen to you?
No.
Okay. Do you feel happy most of the time?
Yeah, most of the time.
Okay. Do you often feel helpless?
No.
Do you often get restless or fidgety?
No.
Do you prefer to stay at home rather than going out and doing new things?
I'm a homebody, yeah.
Do you frequently worry about the future?
No. It is what it is.
Do you feel you have more problems with memory than most?
No.
Okay. Do you think it is wonderful to be alive now?
Sure.
Do you often feel downhearted and blue?
No.
Do you feel pretty worthless the way you are now?
No.
Do you worry a lot about the past?
No.
Do you find life exciting?
Exciting? Yeah, you can say yeah.
Okay. Is it hard for you to get started on new projects?
No.
Do you feel full of energy?
Full of energy? Sometimes.
Sometimes.
Is there a sometimes question?
I'm going to write it. Do you feel that your situation is hopeless?
No.
Do you think that most people are better off than you are?
No.
Do you frequently get upset over the little things?
No.
Do you frequently feel like crying?
No.
Do you have trouble concentrating?
No.
Do you enjoy getting up in the morning?
Yeah.
Do you prefer to avoid social gatherings?
No.
Okay. Is it easy for you to make decisions?
Yeah.
And last one, is your mind as clear as it used to be?
No.
All right. So,
I'm getting old.
let's see.
Not as clear.
So, 1 point for each of these answers. So if this was a no, you get 1 point, I guess. All right, so not a point here. Oh, okay, I see. So 0 to 9 is like mild depression. 10 to 19 would be depression. So I think you're going to be somewhere in the 0 to 9, but let's see. Okay, so we didn't do got 1 here. Don't have 1 there. Oh, this is, I almost need a ruler. 4. Yes, oh, I know, right? It's like very playing tricks with my eyes.
I know, it's like
Right,
little
so you
lines.
often get bored. Here we are. So that's no. Hope this up the future. No. 6. No. Against spirits. Mostly only 7. That's good. Are you afraid something bad is going to happen to you now? Do you feel happy most of the time? 9 is not now. You're doing good. 10, do you feel hopeless? No. Negativity?
I don't think I'm depressed, but
Prefer to stay
who
at
the hell
home.
knows?
I feel like they do this because I get from just in reading articles that they do find that a lot of seniors are depressed. So that's good
I
that
hear
you
that.
don't think that
And
you
at a
feel
certain-
depressed.
Right, at a certain age they do. Because I did something like this at the doctor, like you said. Yeah.
Yeah, I think they just use a shorter version now.
Mm-hmm.
No. 17. Almost there.
Don't take your time.
Yes, 18. Oh, wait. That's not. Oh, no, you're good. Project. I think I'm good now. It was just that middle section was like lots of lines.
Yeah.
21. I guess that counts as a point because it's not a yes or a no.
Mm-hmm.
No. Concentrating. Yes. Do you prefer to avoid social gatherings? Okay, 3. So I would say you are not depressed. Very good.
Okay.
All right, so that's this one and that one. And we'll submit those. And now we're going on to spiritual, culture, and your psychosocial assessment. So living arrangements and work and
This
stuff
might be
like
interesting
that.
for you,
Okay.
the way I think.
Spiritual. So what are your sources of hope or comfort?
Sources of hope or comfort?
Whatever, I guess.
Like
whatever.
external sources?
I guess, yeah, whatever
hope
whatever
and
gives you
comfort.
hope or whatever brings you comfort. You like to be home. Being home could be, I guess, a source of comfort. Your family.
Just family. Yeah. when I think about my family, yeah.
Okay. What helps you during difficult times? Is there anything that you would say that you do often during a difficult time? Crying, reading, funny movies. I guess those would be examples that I could think of.
Yeah, during difficult times, I just try to trying to see what's the best way to say it, like verbally say it. I try to remember or think about the things I can control and can't control.
Okay.
Right? So if it's a difficult thing, I have to think about, what about this difficult situation is in my control and what isn't in my control.
Okay.
That's how I really kind of think.
Got it. Are you a member of any organized religion?
No.
Okay. And so no, the answer to that is no. So the next question would be no. What religious practices are important to you? So that's not applicable. Which I think, since you said no, I think a lot of the rest of the questions might be not applicable.
Okay.
Any spiritual beliefs separate from an organized religion?
Spiritual beliefs.
Like, do you believe that there's an afterlife or?
No.
No.
None of that.
And then the next question was what spiritual practices are most helpful, so that doesn't apply. This is effects on your care. Is there any conflict between your beliefs and any health care that you may receive or be receiving? So, in other words, any health care, like anything that your doctor recommends. I think you kind of mentioned the Ozempic or something. Maybe that could be a good answer for this. So anything that your doctor recommends, but you
it's not a spiritual belief.
Yeah.
Is with that particular thing, it's just my concern about side effects and things like that. Nothing to say that I don't agree to do this because of my religious belief, right? I don't believe that you do, like some people won't have a blood transfusion or things like that. No, I don't have any kind of beliefs like that.
Okay. Do you hold beliefs or follow practices that you believe may affect your health care? So I guess you kind of just answered that as a no.
No.
Do you ever wish to consult with a religious or spiritual leader when it comes to making healthcare decisions?
No.
Okay. Cultural. What racial group do you identify with?
African American.
Okay. Is that your entire ethnic group? Do you have any other ethnicities?
I probably do, like we all do, but I don't compartmentalize them out. We all got a bunch of stuff.
How closely do you identify with your ethnic group?
When you say closely identify, I mean, so when I think about being an African American, I identify with other people that look like me.
I guess.
That kind of thing.
Yeah.
I guess, that's how I identify with that, maybe.
So closely. Okay. Yeah,
nobody ever asked me that question, but
I don't think I've ever been asked that question myself. What cultural group does your family identify with?
Cultural group? My family is biracial, so yeah, I would say biracial. Okay. It's not one thing.
Yeah. You obviously are speaking English. Do you speak any other languages? Is that your only language you speak in your home?
Right.
Okay. You don't need an interpreter. You seem to be understanding me fine. You don't need an interpreter. Are there any customs in your culture about talking and listening, such as the amount of distance one should maintain between individuals or making eye contact? There's no issues with...
No, okay. I've heard of that, but not, yeah.
How much touching is allowed during communication between you and members of other cultures?
Touching?
I know there's certain cultures that
Right.
like a male can't touch a female.
Yeah.
You don't have any of that.
Yeah.
Okay.
I know I have a colleague that's Indian, and you know, you can't touch her like certain. I don't have that though.
Okay.
So
how do members of your culture demonstrate respect for one another? Is there anything special that they do to respect one another, or just
we just respect
one another?
Yeah, there's nothing specific. Like we don't bow or things like that, or curtsy.
Okay.
No, like it's a sign of respect, right?
Yeah. What would you say are the most important beliefs about your culture?
The most important beliefs.
Yeah. If there are none, then that's okay too.
I don't know. That's a trick question. I don't know.
I wouldn't probably know how to answer that myself.
Yeah.
What does your culture believe about health? Any certain health beliefs, or you kind of just?
So when you say culture, I think what's throwing me is the term culture.
Yeah.
Like I don't know that there's a uniform like belief across African Americans. Like all African Americans believe this, right?
Yeah.
So I'm gonna
like other cultures. There's not so much. Okay.
If there is, I don't know of. I don't know of it.
So we're
not
gonna
aware.
Just say that doesn't apply.
Okay.
No beliefs about illnesses and the cause of any illnesses. Like you guys don't have any.
No.
Okay, so we'll say nothing with that. No attitudes in specific about healthcare. No.
No.
I won't go to the
not
doctor
that
for any reason.
Yeah, not that I'm aware of.
How do people in I'll say your family, because there's the culture word again. How do people in your family relate to healthcare professionals? Are they trusting of them?
Yeah.
Okay.
Yeah, we go to the doctor.
Okay.
Yeah.
Is there any rules about the sex of a person, as far as like you can't have a male provider, or your son can't have a female provider?
I have a preference, but not.
Okay, but no.
There's
rules.
no cultural rule.
Okay.
Yeah.
Any rules about exposure of body parts during exams? Any restrictions about discussing sexual relationships or family relationships in your family? Like, do you guys? There's no restrictions of speaking of any of that stuff.
Oh no.
You have there's that question. Do you have a preference for your healthcare provider?
I prefer
to
women.
be a member of your culture. So do you prefer somebody from
like a black
African
woman,
American race, or does it not matter to you?
Don't matter.
Okay.
As long as they have the degree
the rest of the question.
education and they know what they're doing.
What do you think your family members believe about mental illness? Like, do they have any beliefs about it? Do they believe in it?
Okay, so this is a good one. I'm gonna say culturally, right? There has been, I think it's getting better now, but historically it has been kind of taboo, not talked about.
Okay.
Do you know what I mean? Am I explaining that
correctly?
Perfectly. So today, fast forward to today, I think, culturally it's more open, more talked about, more addressed, and it's not this taboo stigma that's hidden.
Yeah.
You don't talk about that.
That's a
kind
good
of,
answer. Any topics of your culture that you would not discuss with a nurse or a doctor?
No.
Any rituals or practices performed by any members of your family when someone is ill, dying, or when they die? Any specific things that you guys might do within your family?
Not a general thing. But when my mother was passing away, we had several family members come and they prayed for her, kind of thing. That was fine, but it's not something that's like, you have to do this. It's part of our culture type thing.
Okay. And then next question, who is the head of the family in your culture? The head of the family in your culture.
Who's the head of the family in your
I guess
culture?
that would have been your mother.
It
You
would
said
have been
your mother,
as
so
far as,
no.
but it's our
You?
nucleus, you know. Yeah, I guess the matriarch was my mom when she was alive.
And then who makes decisions about healthcare, about your healthcare?
I do. Nobody else.
Almost done, I think.
It's interesting though.
Yeah.
Got my brain going.
Yeah, keeping you
Yeah.
on point today. Do you or any members of your culture use any healers or remedies? Any special remedies that you use?
No.
So this one's next, not applicable. And you said you don't belong to any religion, correct?
No.
Do your family members belong to any certain religion, or do they also not follow a religion?
When you say family members, is that
like
immediate family?
Yeah, like
maybe no, I don't think
your
so.
Your children, your siblings.
I don't think so.
No.
Do you guys? I don't. We don't really talk about it. I don't think so.
No influences on your diet. No special.
No.
Nothing you can't eat or anything like that. And spiritual beliefs. You answered no to spiritual beliefs earlier.
Right.
Since you don't have spiritual beliefs, I'm going to assume that nothing influences your health care. You said you get a blood transfusion, and just trying to help you understand the questions.
Yeah, that's good. No.
Are the cultural groups in your community that provide support for you? Are there cultural groups in your community that provide support for you and your family? Do you have any immediate people in your community that help you?
No.
That are from? Yeah.
No, not now regularly.
And this is not applicable because that's about that.
Mm-hmm.
Okay, moving on to psychosocial. Do you have a significant other?
No, unfortunately.
Who's included in your support systems?
My kids.
Okay. And self-concept. It's a very vague question. Self-concept. How do you view yourself? I'm trying to think of how I can word this. It just says self-concept, so it's not really giving me.
That's all it says. Self-concept, right?
Of psychosocial assessment. So I guess would you say you're well off? You're not struggling.
Right.
Okay.
I would say I consider myself grounded.
Okay. I'll take that.
Pretty grounded.
What do you see when you look in the mirror at yourself? Are you satisfied when you look in the mirror? Do you look at yourself and say, I'm beautiful?
Other than my weight, right? I see a very good person.
Okay, that's good. That's a good thing to see when you look in the mirror.
Yeah.
This doesn't apply because it says, how would your significant other describe you? Describe what you like about yourself.
I like a lot of things about myself. Let's see. I like that I feel like I have a very caring personality.
Okay.
I like that about myself. I like that I genuinely care about other people.
Okay.
I like, you said about myself.
About yourself, yeah.
Oh, okay. I was going to veer off.
Just yourself.
I like that I can be, determined.
Okay.
If I put my mind to something, I like that about myself.
Okay.
And I like myself in general.
Okay. And then would you say you have any dislikes about yourself?
Well, any dislikes about myself, it would be outwardly, like my physical weight that I'm not particularly happy with.
Okay.
But it's not to a point where it is it consumes me, you know.
And I think that falls into the next question. What changes would you make in yourself? Would it be directly related to weight or any other changes that you would make in yourself?
Just, work more towards a healthier me.
Okay.
Would be a change I would make. Which
What
is not as easy as it sounds.
Yeah, that's tough.
Yeah.
What would you say your strengths are?
Oh,
Interview question.
I can. If it's an interview question, I can tell you a lot of other, for things
strengths
like that.
With, I guess, your character, your personality.
Yeah.
Karen.
So, I would say a strength of mine is I don't give up.
Okay.
That's the strength of mine, like, from a personal perspective.
Yeah.
And I'm reaching back in my life, from, divorce and abandonment and stuff like that. I could have easily just given up, but
and you rose above.
I did not.
Very
so
good.
I felt like that was a good
strength.
That's a good strength.
And then followed by, what would you say your weaknesses are?
A weakness is, and I definitely identify with this, that I tend to take more care of others than myself, if you want to call it a weakness. But I tell my team in work that I don't like the word weakness, but I say that everybody could develop.
Okay.
Right?
Yeah.
So what's an area of development is, right?
Instead of
to start take care of you. It's almost to put the mask on yourself first and then help the others. I'm learning how to do that.
Very good. We'll go into education. What's your highest level of education?
Associate degree.
Okay. And what do you have an associate's degree in?
And academic studies with a minor in human resources.
HR. Occupation?
My new title? Director, HR Director, Employee Services.
Employee Services. That is a lovely title. Congratulations. So employment, occupation, title. When did you start, I guess, at this employer? And then I guess we can say...
6.5 years ago.
Okay.
So that's Easter Seals, New Jersey.
And the director is a new title for you within a
year. Yep. Very new.
Okay. How would you describe finances? Doing, I guess, that's a very vague question. Also, actually right below it, so it says, how would you describe your financial situation?
I would say stable.
Okay. And then, have you experienced any changes, like drastic changes in your situation? I guess financial, because it's under the finance column.
No drastic changes.
Okay. Do you have any interests, hobbies that you like to do?
Oh yeah. So I like to read.
Okay.
You see my books everywhere. I love to read. I like puzzles.
Okay.
Love puzzles. Anything that's, thought-provoking. I play this card game with a group of ladies for past 30-something years called Pokino. Okay. I do enjoy that game and playing the game with the group of ladies. I enjoy that. Okay. And I just, in general, I love the holidays and being around the family around that time. It's like a thing. It's, it has nothing to do with religion or anything. It's just that time of year that we all kind of come together. I love that time of year, yeah.
And then the last of it really is just risk factors specific to your age group. Okay. Based on what you kind of said as far as like your concerns with yourself, I just put like health quality. So you're a little dissatisfied with your weight. And then primary prevention strategies that we'll have to be included into my project here would be that you would just, so primary prevention strategies, you already said you go to the doctor yearly, you get your blood work, you get all your testing, so you're already on top of trying to minimize and prevent disease. So so that's good.
Yeah.
And then the other thing I could think of is just especially with osteoarthritis and any type of joint pain and issue would be fall risk. So that's just something you want to try to
I've
make
been
sure
recommended to try to keep moving and walking
keep
you know,
walking,
keeping the joints going.
and you don't have any like loose rugs around the house, and maybe not wearing soft things on your feet to fall. Keep the house lit at night if you need to use the bathroom. Those are ways you can minimize fall risks.
Okay. I do all of those things, by the way.
And I think that's really it, because those were the only two I could really think of specific to this client. There's tons of risk factors for anybody over the age of 65, but I think those are the specific ones. Maybe also we could include the cardiovascular, since you have a history of high blood pressure and high cholesterol. But it sounds like you said you go to the cardiologist once a year. You do all recommended
They do a stress
testing.
test. They put me on a treadmill. And
so
every
looks
year
like you're following all the things you're supposed to do.
I try.
Okay. All right. Well,
try.
this concludes our interview. I do thank you for your time and
that's
your patience. That's it. Oh, learning needs. Oh, one more thing.
Okay.
So anything that I guess I could recommend for you for learning needs. I really can't give you anything because it sounds like you're already doing everything that you're supposed to do. You go to the doctors, you follow up on all of the things that you were supposed to be doing. You do your cardiac health, you do dental screenings, you're doing your gynecological health, your woman health. So
just trying to stay on top of everything as the doctor recommends.
And obviously any
and
questions
my immunizations.
Any questions that you have throughout the year, just never hesitate to talk to your doctor about them. That way anything that comes up, you can stay on top of it. It's always easier to stay ahead of things than to chase things.
Yeah, for sure.
Okay. All right. Well, thank you very much. Okay.